If you're okay, Dr. Patil, we can begin. I think the people will join in as time goes with us.
Yeah, no issue.
Yeah, yeah, great, great. Okay, again, welcome everyone who is present here uh, on our fourth day again and the final session for the day. And as we have seen since morning, we have had a great interaction, and I am assured that this would be again continuation of that great contemplation on sciences of Ayurveda. We have with us Dr. Nilesh Patil, uh, a third of our esteemed guests today, again an Ayurvedic practitioner for with more than a decade of experience in practice as well as teaching. Again, after completing his BAMS and MD, is currently pursuing his PhD from DPU Pune. Apart from that, he also has been a co-PI in a clinical study which focuses on Treshajana Yoga and Rasayan Churna, funded by DPU Pune. He has completed his Yoga Praveshika, a certificate course by Yoga Vidya Gurukul, and also has completed a basic course in counseling by FPA India. His training in Sanskrita is also happening in collaboration with IIT Roorkee. He currently is working as an associate professor with more than 2 years of experience in D.Y. Patil College of Pune. Along with that, he's member of Vaidyamitra, which is run by the Kolatkar Pratishthan and Ayurved Vyasapeetham in Pimpri and Chinchwad. In terms of various accolades and honors that he has to his name, he was awarded first prize in late by the Bindu Madhav essay competition, second prize for best paper presentation in Ayucon Pune in 2018, third prize in national essay competition. He has also been awarded with a very prestigious Ayurvisharad Award by Himalayan Drug Company for standing second in his final year of BAMS, and a special reward by Sai Mauli Institute of Ayurveda for standing first in second year of BAMS. I welcome Dr. Nilesh to today's session,
Thank
and I believe his multidisciplinary approach as a practitioner and as a teacher also would help us to understand the more application base or side of Ayurveda.
you.
Sir, over to you. Just to
Yeah. Okay.
begin. Yeah.
Yeah, I will share the
Yes.
screen.
You are able to share
Okay.
this.
If you can make a co-host. Yeah.
Yes, yes. I request the uh, host to please allow sir to share his screen. Dr. Patil, if you can check, I think they have given you the permission.
No, not yet.
Not
It's
yet.
still
Okay.
saying, okay, just now. Okay.
Yeah,
Yeah. Okay.
yeah. As I said in the morning, there are
Yes.
like three geographical points that we are coordinating on. So I'm sitting here in Delhi, and the technical team is in Kanpur
Okay.
University. So
Okay.
sorry for that. Yeah, please, please, sir. Please continue.
I think now you can see the screen, right?
Yes, I can. I can see your screen, not the
Yeah.
presentation. Now I can. Yeah, yeah.
Yes. Just a sec. Okay, so what I will do is I will just stop the video so that it will not eat up my broadband. So it will be easy and my voice will not break. If that's
But
okay.
we can hear you and see you clearly, sir. If there is a
Okay. So if
problem,
there is any issue, just let me know because I will be doing the screen full now. So I will
yeah, yeah,
not be able
yeah.
to handle
I
that.
will. I shall inform you, so don't worry.
Yeah.
But now it's great. It's great. We can go ahead.
Yeah.
Yeah. It's good to
Okay.
see
Now
you.
it's
So
full
yeah,
screen.
yeah, 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 it is. It
Yeah.
is.
Okay. Yes, okay. Good afternoon, all of you. And first of all, thank you to Sushanji and Bhugat and Kanpur University also for giving this opportunity to share some views on the application and the way forward regarding Ayurveda. I am hoping that those who have joined now also have come across the two sessions which have been previously conducted by Vibhav sir and I think Chinmay sir. So some of the base of Ayurveda has been cleared. That is what I'm expecting because going ahead in our session, we are going into application of that Ayurveda and also how we can make it more global. So basically, just to clear the agenda for my today's session is that I'm expecting is not just at an individual level, but also to think on the application or at the institute level and also at the international level, let it be research or something else. Because as a learners of Indian knowledge system, I think what we are lacking in a sense is applying them and taking them forward. So that is the major issue which our sciences are facing. So I'm not just going to speak about how to use Ayurveda for health. I'm also going to speak on how we can take Ayurveda toward more global science. So keeping that in my mind, so why we need this? You know, we are all talking about how advanced modern science has come, how advanced it has technology has gone towards even modern medicine too. And still we are talking about alternative medicine. Let it okay कि, Ayurveda alternative medicine hai nahi hai. Let's not go into that. But still, what is called as other than modern medicine, let it be a Chinese medicine or our Ayurveda, they are called as complementary and traditional medicine. But why we are talking so much about these alternative medicines or about these complementary sciences is this picture. Now, this picture is actually taken from National Health Profile. So it is all the facts. It is nothing like I'm just saying out of something. मुझे लगा इसलिए बोला ऐसे नहीं है. These are all facts. This was actually the survey which was done by ICMR to see what is actually the disease burden on India. It was, I think, around 2016 to 2018 somewhat. So during that, what they found out, and this picture is about India. Okay, it's not the what you can say the percentage are not about the world stage. These are about typically India. That is the communicable diseases, like we say that there is a COVID or malaria, typhoid, like these communicable diseases, or neonatal diseases, or nutrition related diseases. They have decreased from 61% to 33%. But on the contrary, what has happened is the non-communicable diseases, what we in layman language we call them as a metabolic disorders or lifestyle disorders, they have increased from 33% to 55%. So it is not like we have become more healthy as a society. It has remained unhealthy as previously, just the spectrum of diseases have changed. Before it was communicable disease, now just it has shifted the focus from non-communicable to non-communicable. So that is the one of the basic reasons why we are now talking about Ayurveda or Chinese medicine or any traditional medicine. And not communicable, the more dangerous picture we can see or speak of, that is a cancer. And that is very heavy burden going to be not just on India but also at the world stage, is because of even when we were at the child's age, so we used to hear some cancer patients which was long 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 ago, like यार हमारे यहाँ पे किसी को एक व्यक्ति को कैंसर हुआ था. We used to talk in that language. Now, what has happened is in our neighbor only we can see two, three, four patients of cancer. So that also we have to keep in mind that if you can see, incidence rate and dialysis disability adjusted life years of cancer, it has increased from around 35% and 22% between 1990 to 2020. And not just that, mortality just means death because of a disease. So mortality rate because of cancer has increased by 46%. It is 46%. Why I am highlighting these percentages? Because we always talk about the technological advancement and modern science. Like we are talking like chemotherapies, radiotherapies, and all new types of stem cells and all. These are all advanced so much, and still mortality rate has not decreased. On the contrary, it has increased by 46%. So that is the picture of non-communicable diseases. Let it be lifestyle diseases, including cancer, that they have tremendously increasing. And that's why we need to change our focus from just thinking about the viruses or the bacteria or the causes of the communicable disease. Now this is what WHO is saying. This is not any Ayurveda person, because someone may say you are from Ayurveda background, so you may be more biased toward Ayurveda. But this is the strategy which was made by WHO, a traditional medicine strategy which was for around 10 years, 2014 to 2020. What traditional medicine stands on the way of coping with the relentless rise of chronic non-communicable disease. See, when you are reading such strategies or such documents, we have to see the words which they are using. They are using the word relentless rise. It is not like यार 1-2% से कुछ बढ़ा है या फिर 2% से बढ़ा है. It has been relentless. And when these chronic non-communicable diseases comes into the picture, there is what Ayurveda or any traditional medicine can help out in our way. So this is what WHO was saying, and that's why I'm taking this quote, which I think we know all about this person, Louis Pasteur, who started actually the theory of bacteria होता है. एंड उसके वजह से फिर वैक्सीनेशन वगैरह स्टार्ट हुआ. लेकिन इट इज सेड दैट कि ऑफ कोर्स कि लुइस पास्टर व्हेन ही वाज ऑन द डेथ बेड, he said something like that कि माइक्रोब इज नथिंग बट सॉइल इज एवरीथिंग. ऑफ कोर्स इट इज नॉट डेफिनेट कि ये उन्होंने कहा है, ये ऐसे कंफर्म कोई बताता नहीं है, लेकिन स्टिल इट इज सेड कि ड्यूरिंग हिज लास्ट डेज ही सेड लाइक दैट. Ultimately what he's trying to say is what in a modern science what has happened is we are almost concentrated on what is coming from outside into the body. We are not concentrating the human body as person, because if you see any traditional medicine, let it be Ayurveda, we always think of a person first and then of the other things. So I think it is not even an Ayurveda person. Louis Pasteur himself said that what we need to think about the resistance of about the immunity or about the human body more than what is coming from outside, like a microbe. Okay, so this is keeping all these things in mind. What we need to do when we are going ahead with Ayurveda or any Indian knowledge sciences, what we need is a shift, and it is not a slight shift. It should be a paradigm shift, for specifically for Ayurveda or specifically for medical science, so that we can move towards more of a multi-dimensional, multi-level strategy. We have to think at multiple levels. It is not just as an individual level which need to target, because see, we will see in next few slides also कि health is not just a thing which is dependent only on a person. There are other determinants of health which are also responsible for determining how much healthy you will be. So that's why when we are thinking about this relentless rise of what you can say non-communicable diseases, we have to think not just dependent on viruses, bacteria, and all. We have to think on a multi-dimensional. There should be multiple angles. See, even health is not a thing which is dependent on one factor of an individual. मैं आज क्या खाता हूँ सिर्फ उस पर ये डिपेंड नहीं करता कि मेरा हेल्थ क्या होगा. ऑन द सेम वे जैसे मैं कितने बजे सोता हूँ, कितने बजे उठता हूँ, मैं भूख लगती है तभी मैं खाना खाता हूँ या नहीं खाता हूँ, इतने सारे फैक्टर्स आते हैं, देन इट डिसाइड्स द हेल्थ ऑफ पर्सन. So at an individual level also and at a society level also, what we need is a more of a multi-dimensional, multi-level strategy. So I'm going to speak ahead with this lecture, what I'm trying to do is to elaborate this all-inclusive pathway which we can apply, so that we can achieve what we can say सर्वाणाम सर्वेषु सर्वत्र जाएगा. तो हमें आयुर्वेद जो है एज अ पार्ट ऑफ इंडियन नॉलेज साइंस has potential. It is. I'm also going to speak about next also. We need not, limit Ayurveda to only India or a culture. As said, we have to treat Ayurveda as a science, not just as a part of some singular community or singular religion. Okay, so if we want to achieve this Sarvanam Sarveshu Sarvatra, we have to treat Ayurveda as a science and not just a part of a culture or religion. So I think in previous lectures you definitely must have gone through the definition of a health. Samadosha samaganisha samadhatumalak kriya prasanna atmendriyam manah swastha ityabhidiyate. So that's why I was saying, कि health is not just the one aspect of a human body. It covers all the many aspects of this. So see, if you think ना कि जो great thinkers होते हैं ना, they always think alike. So that I always conclude कि जब आप कुछ देखते हो कि जो अच्छे और बड़े विचार करते हैं ना, उनके विचार हमेशा जुड़ जाते हैं. So similarly, if you can say, WHO की भी documents अगर आप देखोगे, they have said that the context of people's lives determine their health. Okay, it is not just person. See, what WHO says is a context of the lives. And so blaming individual for having a poor health or crediting them for good health is inappropriate. Inappropriate means it will be a limiting part. Okay, so many factors come together to affect the individual's health. So those factors are called as a determinants of health, and they can be individual, they can be institutionalized. Okay, so like they have given an example, like they include about what is your financial status, what is your social status, how much is your education, in environment which you are living, how is that physical environment, or how much support you get when you are deceased. So that is also an important part. Genetics of course plays a role. Then there is a gender and health services. All these factors come together and then they contribute towards the health of an individual. So we need to understand that when we are talking about a way forward for Ayurveda, we should not only concentrate on an individual, we should concentrate on all these determinants of the health. And that's why, as I said, what we need is an all-inclusive strategy while going ahead for Ayurveda. See, whenever need and just a supply and demand ऐसी चीज होती है, okay, so there has to be a problem, then only it can be a solution. So whenever you are starting a new way, whenever you are doing something new, there has to be some problem and there has to be a clear cut problem statement. That is what we are facing and what we need to do, and then we can think on how we can do it. So first of all, what is important is a problem statement, because if you target the problem correctly, you definitely have some solution in it already. Okay, so that's why the things, what are the problems now, even at 2024, even irrespective of the advancements in the technology or in the modern science, these are few statements which need to be addressed as an I guess person. That is increasing burden of non-communicable disease. We already spoke about that in the first slide only, that they have increased from 33 to 55%, and it is of 2020 data. I think in last 5 years it must have increased at least by 5 to 10%. So that is that increasing burden of non-communicable disease. Now, it is not just limited to non-communicable disease. Probably you must have heard with Chinmay sir or Vibhav sir also that we have some biases in our mind. So when it comes to Ayurveda, we always think of like कि Ayurveda is for chronic conditions, like कि 4 साल से 5 साल से स्किन डिसऑर्डर है, या फिर 4-5 साल से ऑस्टियोआर्थराइटिस टाइप जॉइंट डिसऑर्डर कुछ तो है, एंड देन एलोपैथी सर्जन सम सजेस्ट दैट योर नीज हैज टू बी चेंज, आपका नी सर्जरी करना पड़ेगा, देन पीपल कम टू आयुर्वेदा and they ask for the treatment. So that is one of the basic myths or biases of a person, that Ayurveda is only for chronic disease. It is not like that. Ayurveda definitely works. Vibhav sir and Chinmay sir must have already told that they work definitely in communicable disease. I think the main you can say the goal, or you can say main proof of that is what happened in India during the COVID, because so-called advanced countries and all the foreign countries were saying कि it is going to be a chaos in India when COVID will be there, but on the contrary, it was totally a different picture in India. Whatever even IITians and all those, they show the picture like that it will be 300% increase and the COVID will be that much severe and that much deaths will occur in India because there is no such primary healthcare system and all that. But still it didn't happen, because there was something which was percolated through our entire history, and that was Ayurveda, which was there not in the form of medicine but in the form of our lifestyle, which was from हम जो बोलते हैं ना, हमारे दादी माँ से नानी माँ से जो हमारे परंपरा से जो आया था, इट स्टेड ड्यूरिंग अस ड्यूरिंग दैट कोविड, एंड इट आई थिंक मुझे लगता है कि उसने बहुत सारी चीजें सेव की, फाइनेंशियली भी और फ्रॉम द पर्सपेक्टिव ऑफ लाइफ ऑल्सो. सो ये दोनों चीजों ने ये जो हमारा आयुर्वेद या फिर हमारी इंडियन नॉलेज सिस्टम है, उन्होंने ये ड्यूरिंग कोविड ये प्रूव किया कि इम्यूनिटी नाम की जो चीज होती है, ये एक दिन में 2 दिन में बनाई नहीं जाती. Okay, so immunity is not a thing like a one night star. It has to be cultivated. It has to be modulated throughout the years, throughout your lifestyle. Then you can make a way throughout the severe sorry, epidemics like COVID. And Ayurveda definitely played a great role, and it not just in a part of medicine, but in a part of lifestyle which percolated through years of life. So second problem statement is important for that, because communicable disease also give rise to severe morbidity. Morbidity means disabilities. Like if you must have heard that COVID cases after some time when vaccinated persons face heart attacks and strokes. Okay, so this is the communicable diseases leading to morbidities. Like they are giving rise to other disabilities. So that is another problem we are facing. Then the third problem, I think everybody will agree, is the increased financial expenditure because of the disease burden. If you see the treatment cost of cancer on chemo and radio, you will agree to this, because the financial burden which happen on that family, on that person, is very huge. Okay, that is the third problem. And then lastly, providing the universal primary healthcare. See, universal primary healthcare is what, any end user, any end individual of any country should be able to access that healthcare system. That is expected by universal primary healthcare, and which is still lacking in India. अभी भी आप रूरल एरियाज में जाओगे तो मेनी जो रूरल एरियाज है वहां पर अभी भी कोई भी हेल्थ केयर सिस्टम एस्टेब्लिश नहीं है. People are still have to travel long distances to reach the hospitals. So that is what I meant by universal primary health. So jab hum abhi we will be seeing ayurveda for globalizing, we have to target these problem statements. Now solving these problem statement, what is needed is an integrative strategy. Okay, so just want to clear first thing here, that when I'm saying an integration, I'm not talking at all about integrating the concepts of ayurveda and other medical sciences. What I'm talking about is integration of all the multiple medical sciences which are established at this stage, to come together and then tackle such things. So this is again, told by WHO head at that time, that two systems of traditional and Western medicine need not clash. Okay, within the context of primary healthcare. See, this is very important. Primary healthcare, because it has to reach the end user. It has to reach the end citizen of any country, that they can blend together in a beneficial harmony and using the best features of each system, compensating for weaknesses in each. And this can do something that will happen all. This will not happen by all itself. We have to come together, and deliberate policy decisions have to be made, but it can be done successfully. Okay, so that is what I'm saying when I call an integrative strategy. See, हम एक दूसरे को ब्लेम करते रहेंगे तो ये जो लेमन जिसे हम बोलते हैं कि जिनको ये हेल्थ की जरूरत होती है, वी कैन नॉट बी एबल टू डू दैट. सो हम अकेले अकेले ही काम करते रहेंगे, वी विल नॉट बी एबल टू अचीव दैट. वी हैव टू कम टुगेदर सो दैट वी कैन अचीव मेनी मोर थिंग्स. नाउ व्हेन ये जो हम बोल रहे हैं ना कि इंटीग्रेटेड, सभी लोगों को एक साथ आने की जरूरत क्यों है. अगेन ये जाते जाते मैंने कुछ बोल दिया, लाइक पंच लाइन और समथिंग लाइक दैट. इट्स नॉट दैट, but it is what is in research. So these are all the references from the good scopus journals, which says that there are limitations to unisystem treatments. अभी मैंने जैसे बोला कि यूनि का मतलब सिंगुलर सिस्टम, तो अभी एक ही कंटेम्प्रेरी मेडिसिन का सिस्टम है, लेकिन देर आर लिमिटेशंस एंड रिसर्च आर प्रूविंग इट अगेन एंड अगेन, and we are not accepting that that is the issue. So and not just that, the surveys are also saying that residents themselves are exercising the alternate therapies, recognizing the limitations of monoculture health system. So क्या हो रहा है ना कि लोगों को समझ में आ रहा है, लेकिन ये बीच वाले जिसे हम बोलते हैं ना, सो कॉल्ड scientists or researchers, which are not actually open to the ideas, because for a good researcher or for any good scientist, he or she should be of an open minded to any ideas. And because of these close minded people, what is happening is a layman can understand that monoculture health system cannot work, but they are not accepting that. And integrating the alternative medicine can achieve better access and health equity, specifically in low and middle income countries. So it includes India. So ये integrate करना आयुर्वेदा और अभी जो मेडिसिन की सिस्टम चल रही है, यही सॉल्यूशन दे सकता है. ओके, और यहाँ पर उन्होंने ना दे हैव शोन लाइक ये इंटीग्रेशन कैसे हो सकता है. तो पहला उन्होंने बोला है कि लाइक देयर शुड बी अ सिंगल एजुकेशन सिस्टम, व्हिच इज totally no. I think it's definitely not possible. But second model, they are saying that two systems can run parallelly and keep distinct, and still they can try to give a positive impact on the health of people. This has been very effectively applied in the China. That's why I've given the example, because in China, whenever the patient goes to the hospital, he has freedom to choose whatever. Yeah, it can be modern medicine, it can be a traditional medicine. The choice is given to a patient, and doctor doesn't decide what is best. So it has been already implemented in China, and we are still lacking in that. So about 90% of hospitals provide the traditional medicine services. So 90%, that much of integration has to happen if we want to achieve the universal primary. So 90% of hospitals provide the traditional medicine services there, and then the patient decide if whatever he wants to. So that type of integration, what is expected. Now going ahead, जैसे मैंने बोला कि what are the strategies and what things which need to target. So these are the four areas which I think, okay, it is a personal opinion again. The more experienced person can show more angles to this part. That when it comes to health, there are at least four things which we need to consider on, or the four things on which we need to work. That is at an individual level, because if you are healthier on a your choice, it is because of your choices you are becoming healthier on it. So at an individual level we have to work. Also at an institutional levels, let it be government institutes, colleges, research institutes. At that institute also, then there is a part what we have to do because of the time, that is the research. And then lastly, working at the level of international. So these are the areas which we need to work going ahead, a way forward for the Ayurveda as a part of I guess. लेकिन ये सब करते वक्त कौन सी चीजों को ध्यान रखना जरूरी है कि वॉट एवर द पॉलिसी और वॉट एवर द स्ट्रेटेजी वी डिसाइड, इट शुड बी इंक्लूसिव. Okay, that's why very first thing which I was saying, that it should not be constrained to any religion or any country. It should be inclusive of all people. Should be inclusive of all genders, sexes, and anything. Okay, so that should be inclusive irrespective of socio-economic status or gender or such things. Then there should be a personalization, which is the basic lagging issue with the modern medicine. There is no personalization. So that is the second thing. Then it should be economical, as I said, because one of the problem is the financial burden. Then it should be sensitized, because what happens is mostly persons or physicians from other pathy, they just keep on blaming the other sciences. So they keep on blaming, like देखो कि आयुर्वेद वालों ने ये सब कर रहे हैं, ये इसमें मेटल्स होते हैं, इसमें टॉक्सिन्स होते हैं, इससे कुछ काम नहीं होता. फिर वो गुरुजी का काढ़ा लोगों ने लिया तो उनके लीवर फेल हो गए. So this is not the way to treat a science. Okay, so to see a science basically. So we need to sensitize the people, we need to sensitize the researchers and the great physicians, to make them aware that what is happening and what need to be done. And then it should be very much important, it should be accessible. That हम बहुत बोल सकते हैं कि चलो सभी लोगों को ये पंचकर्म करने चाहिए, लेकिन इफ पंचकर्म हम बोल रहे हैं कि पंचकर्म करना चाहिए, लेकिन इफ ये accessible ही नहीं है, then there is no use of that policy. So whatever you say, it should be accessible. So these are the things which need to be keep in mind. And now, speaking about the first level which I was talking, of course, most important is the individual level. Why individual level is important? Because this might have come across the previous sessions also, that Ayurveda think every individual as a separate entity. Purusham Viksham. See, fever of one person is definitely not same as the fever of another person. Okay, even though in a better example, COVID-19 of a one person will not be same as a COVID-19 of another person. So that is what is meant by when we say Purusham Diksha. So that's why individualization has to be done, personalization has to be done. You have to treat every person as a separate. Okay, because you have his lifestyle will be different, his eating habits will be different, the area where he was born, that will be a different. So all these factors come into one thing, and then they lead to the manifestation of a disease. See, that's why you must have seen, I think all are academicians and highly qualified. You must have seen, during COVID, there were categories like asymptomatic COVID to the जिसमें ICU admit करना पड़ा और respiratory distress हुआ. So there were people जिनमें कोई एक भी symptom नहीं थी, यानी just accidentally, just he or she wants to travel and he had to do that RT-PCR, and then he did it, and उसमें वो COVID-19 मिला, and he has to stay at home. Okay, so they were such person जिसमें एक भी symptom नहीं था, and still they were COVID positive. एंड देन देयर वर पर्सन जिनमें 2-3 दिन में ही आईसीयू में एडमिट करना पड़ा एंड दे डाइड एट ओके सो व्हाट वी नीड टू थिंक इज कोविड वायरस इज sick that COVID-19 is sick. But in one person, it is not in even showing a fever. And in another person, he is leading to a death. That much variation cannot be caused by COVID-19. It is caused by lifestyle. And that's why you have to think every person differently. Okay. That's why you cannot think of COVID-19 only as a cause of a disease. Okay. So when this happens, which are the causes or which are the factors at an individual level which play are the few things which are now we are going to cover. Okay. So for the better promotion and for better preservation of health, what can be done at individual level is first is a panchakarma, that is detox therapies. You know, whatever we are eating, जो हम बहुत खराब खाना खाते हैं, कभी भी सोते हैं, कभी भी उठते हैं, तो उसके वजह से कुछ ना कुछ चेंजेस हमारे शरीर में होते रहते हैं. तो अकॉर्डिंगली जो दोष होते हैं, वात पित्त कफ, अभी आपने सुना ही होगा, तो वो एक्यूमुलेट होते रहते हैं, तो कभी उसको निकालना, शरीर को खाली करना जरूरी होता है. सो दैट इज व्हाट पंचकर्म इज. देन देर इज समथिंग विच आर कॉल्ड एज अ रसायन रिजुविनेटिव थेरेपी. जो हम हमारा जैसे वर्क होता है अकॉर्डिंगली वेयर वी लिव, तो उसके जैसे हम कुछ ऑपोजिट टाइप वाला सेवन कर सकते हैं. ऑपोजिट टाइप ऑफ वी कैन do or follow so that we prevent the diseases. Then there come the major part, that is of a diet. Then there is a sleep, which is the most important and still most neglected factor. Then there is a brahmacharya. We will go into detail after some time. Then there is a sadhrutta, that is more of an ethical behavior individually and in society. And then another very interesting concept of Ayurveda is an prajnaparata. Okay, we will see into that. Then the first thing is Panchakarma. Panchakarma, see what we do in Panchakarma, of course, as the name indicates, it is a collection of 5 procedures which we do. But everybody should be clear that we do not do Panchakarma. We do not do the 5 type of procedures in a single person. It is done accordingly, whatever is important. Okay. Just a second. The interesting thing is it can be used for both prevention and also as a curative part. So if you have fear of like there is a one part we just studied is the genetics is a part which also plays as a determinant of health. So when there is some issue with the genetics, what can be used is a panchakarma for preventing that. So like that there are 5 as you must maybe have heard. So there is a woman in which we induce an emesis vomiting. Then Virechan we use as a purgation. Then Nasya we use some nasal drops. Then in Basti we are giving it like an enema, and Raktamokshan is a bloodletting. So all these procedures which can be used for the preventing a disease and also to the cure a disease. So these are some examples. Please again keep in mind these are just the examples, and just so for example, someone listening to this is having skin disorder doesn't mean he has to undergo virechana only and not hormone. Okay, please understand a decision of a panchakarma is of a doctor and not of a patient. So these are just an example to keep in front of you कि how वैद्य decides कि यार कौन से disease में क्या पंचकर्मा bare minimumly किया जाता है. It doesn't mean ये हमेशा करना ही पड़ता है या फिर इस disease में यही करना होता है, ऐसे भी नहीं है. Okay, so it is just for an understanding purpose. So please don't take it for the face value. It is more of an understanding. Okay, so like there is an too much on obesity, like there are diseases like diabetes, or there are like hypothyroidism. So in such condition, then emetic or woman type of procedure is generally done. Then there is a purgation like तो जहाँ psoriasis होता है या फिर एक्जिमा होता है, बहुत सारे स्किन डिसऑर्डर्स होते हैं, ब्लड इम्प्यूरिटीज की वजह से होता है, तो उसमें जनरली व्हाट वी गो फॉर इज अ विरेचन पर्गेशन. देन देयर आर डिसऑर्डर्स ऑफ हेड और ईएनटी और अदर nasal cavities and all. So in that such conditions we go for the nasya. Okay, we use the drops for take out the extra doshas which are hiding in the upper body. Then there is an enema, generally, which is considered very one of the most used panchakarma because its spectrum is very large. Basti can be used for almost every disease if the doctor is very much intuitive. So basti is one of the half important treatment of Ayurveda. सो लेट इट बी न्यूरोलॉजिकल डिसऑर्डर्स होते हैं, आपने सुना होगा फेशियल पैरालिसिस होता है, या फिर पैरालिसिस होल बॉडी का पैरालिसिस होता है, एक्सीडेंट की वजह से इंजुरीज होती हैं। तो ऐसे सब कंडीशंस में बस्ती जैसे पंचकर्म का यूज होता है। एंड देन अगेन कुछ जॉइंट डिसऑर्डर्स होते हैं जिसमें ब्लड इम्प्यूरिटीज होती हैं। तो ऐसे कंडीशन में ब्लड लेटिंग जैसा, यानी जो खराब ब्लड होता है उसको निकाला जाता है। लाइक इन आपने सुना भी होगा कि डायबिटिक वुंड वगैरह जब होती है तो it takes too much time to heal the wound. So in such conditions, we also go for Rakta moksha. Okay. Up in irrespective of all this, what we have listening now is also important for prevention of a cancer, which I have not mentioned directly in the PPT. But see, cancer-like diseases, these are not a type of a disorder or a disease which happens overnight. Yani you must be following some bad lifestyle over the years, which gets converted into a cancer. सो प्लीज ये हमेशा याद रखो कि कैंसर इज नॉट गोइंग टू हैपन लाइक सर्दी खांसी जैसी होती है कि कल हम थोड़े बारिश में भीगे तो दूसरे दिन सर्दी होती है। कैंसर ऐसे नहीं होता। लॉन्ग जो हमारी बैड लाइफस्टाइल होती है इसके वजह से बहुत सारे दोष जो होते हैं दे कीप ऑन एक्यूमुलेटिंग, एंड एट सर्टेन स्टेज इट बिकम्स बियॉन्ड द थ्रेशोल्ड फॉर द बॉडी टू मैनिपुलेट, एंड आफ्टर दैट थ्रेशोल्ड इट लीड्स टू कैंसर लाइक डिसीजेस। So in such things, Panchakarma can be one of the most effective therapies to prevent the cancer. That is my open opinion. And I can say it with confidence because you will see there are many already Ayurveda cancer care centers which are doing the research on this. But it has been proven. What happens with preventive Panchakarma is whatever the bad lifestyle you have followed now, so whatever the dosha has accumulated in your body, you will clean out them with the panchakarma. So what will happen is the positive factors which are residing in your body, they will not be there, okay, to cause a cancer. So to prevent such cancer-like serious disease, panchakarma is one of the you can say the great tools which can be applied at a national level, and that should happen. So that is also one of the options. And not just cancer, you must have heard after COVID there have also been rise in an autoimmune disorders. ऑटोइम्यून डिसऑर्डर्स मतलब हमारे ही सेल्स होते हैं हमें ही अटैक करने लगता है। ऑटोइम्यून का मतलब हमारे जो व्हाइट ब्लड सेल्स वगैरह आपने सुना होगा जो हमें प्रोटेक्ट करते हैं अगेंस्ट एक्सटर्नल वायरसेस एंड बैक्टीरिया। तो उनको ही समझ में नहीं आता कि यार अपना कौन है और पराया कौन है। So what happens is they start to destroy our own cells and tissues. So this is also doesn't happen overnight and due to lifestyle. So in avoiding those autoimmune disorders also, a frequent panchakarma for a person, whatever out of five procedure is good for that person, it can be applied, and the next few serious disorders like autoimmune or the cancer, they can be prevented. So that is the strength of the panchakarma, and that is the strength of Ayurveda. Then these are some of the examples. Just please, again, I'm under saying like here in the same slide as I've shown, there are conditions apply because you need to understand that it takes 1 hour of history understanding the pathology of a person, and then as a physician we go for the treatment. So it is not like यार ये इसको सर्दी है तो ये इसको मेडिसिन दे दो, इतना वो इजी नहीं होता. So again as I'm saying कि whatever the PPTs I will be showing, just keeping that conditions apply. इस हर एक चीज को कंडीशन अप्लाई है ये. सो चिल्ड्रन चाइल्ड का एज होता है, फिर एक मिडिल एज होता है, यंगर एज होता है, और काम का जो एज होता है वो, एंड देन देयर इज एन ओल्ड एज. So again, age-wise, few things which can be added according to person's constitution, his where he lives, whatever his lifestyle is, what work he do. Accordingly, what we can suggest during these ages is like this, so that we can go for not just for prevention but promotion of an health. ओके सिर्फ हमें डिजीज प्रिवेंट करना ऐसे नहीं है, हमें अच्छी हेल्थ भी सुधारनी है. ठीक है. सो उसके लिए करने वाली चीज ये आपने शायद सुनी भी होगी, सुवर्ण प्राशन इज वन ऑफ द अभी वो जिनको जिनको बच्चे शायद उनको तो ये पता होता ही है कि आजकल सुवर्ण प्राशन देना एक ट्रेंड हो गया है. उसमें भी अगेन ऐसे हुआ है कि जैसे एलोपैथी में होता है वैसे आयुर्वेद में भी अभी थोड़ा थोड़ा बिजनेस माइंडेड पीपल आ चुके हैं. सो वैसे ही सुवर्ण प्राशन आजकल एक बूम हो चुका है कि बच्चे जो होते हैं उनकी ब्रेन पावर जो है वो इंक्रीज हो, टू इंक्रीज द इम्यूनिटी. तो सुवर्ण प्राशन इज done, or almost every Ayurvedic Vaidya does that. So that is the Suvarna Prashan we can do for the at a child's age. Also, one of the best food if you want for your child is a navneet. It is butter, but that's why I wrote a Sanskrit word for that. That is navneet. I'm not, because I'm not expecting an butter of some famous company or like that. That butter is not actually the butter. The when I say a navneet or butter, which is made at home, so that is one of the best, you can say, a superfood for your child's brain. So that is the homemade butter, you can say. Then there are few medicines also which are used, but again, please keep in mind these are just for an example, and these are just suggestions which can be applied, which can be used for the increasing immunity of children, or to increase their mind strength and brain strength. Like Arvindasa, Samvardhana Ghruta. Ghruta is a ghee. Samvardhana ka matlab hota hai to increase. So Samvardhana is a name which is given to the medicated ghee, which can be used for the children. And during the middle age, we all know we are very much occupied with the work and all that. Let it be physical or mental. So what can be used is anti-aging medicines which are given in Ayurveda. They can be definitely used for every person. So like Guduchi, this must have you used or heard in COVID. So that was Guduchi. Amla sabhi ko pata hai, Indian guava. It is one of the best rasayana, rejuvenative drug out there. And this is what you can say. You can eat even daily also. It doesn't need any medical supervision. So Amla is like that. You can take even without medical supervision, if only you are healthy. I'm keeping that thing in mind, that I'm expecting whoever will be using this is healthy. If you are a disease, it will not work. You have to consult a physician first. Then there is a Shatavari. Many you must have heard in a pregnant women and all, they use Shatavari and all that. That also. And nootropics are the drugs which are used for a better learning abilities and to decrease the stress and decrease the anxiety, like the Brahmi, Shankha Pushpi. So these can be used because the lifestyle which has now happened, it's more like a rat race. So we have to, if we are wasting our energy on a brain, we have to keep the flow of that passive energy towards the brain. So this can be provided by the nootropic drugs. So like Brahmi and Shankapushpi. So we all have heard the bad things like suicidal tendencies in IT people and all that. So this is just about the mental fatigue and mental exhaustion. So ये इतना हो जाता है कि फिर वो it goes beyond the threshold of that person. So we need to increase that threshold level continuously. For that purpose, Ayurveda can help definitely through these nootropic drugs like Brahmi and Shankapushpi. And at the old age, like nowadays there is so much research going on the Alzheimer's and Parkinson's, because of our lifestyle. What is happening is that dementia is becoming very common, so like a memory loss. So during old age also, very Ayurveda can give ultimate results in such things to prevent the dementia or Alzheimer's or Parkinson's disease, like the Jeevaniya drugs. Like Jeevaniya, what in English you can uh, थोड़ा जैसे हम बोल सकते हैं कि not directly correlated. Just to understand the concept is they are more of a tissue promoting drugs. Okay, so कोई भी टिश्यू हो हमारे शरीर में, उसको वो अच्छा हेल्दी बनाने का मदद करने वाले जो ड्रग्स होते हैं, these are actually the जीवनीय ड्रग. लाइक शतावरी है, ज्येष्ठमध है, लिकराइस जिसे हम बोलते हैं, अश्वगंधा है. दिस कैन बी यूज्ड by the individual according to his constitution. Again, I am saying these are all conditioned apply. It is not blindly लेने की ये चीजें नहीं है, but these can be applied according to age, according to the work, according to their constitution, where we can not just prevent a disease but also to promote the health. Now, another thing which can be, like an example, I'm just putting it applied level at an individual. So these are things which can be applied. जो वर्क किस प्रकार का होता है उसके हिसाब से हम कोई डाइट और मेडिसिन उनको अगर सजेस्ट कर पाए, so that can prevent many things. So the people who are in a physical work, labor work, they can go for Mausar Rasa. Khira is of course milk, and Mausar Rasa is more of a mutton soup or chicken soup. Okay, so again, just to clear out the things, Ayurveda doesn't at all bans non-vegetarian food. Ayurveda openly speaks about alcohol intake also, and also about non-vegetarian food. Okay, because for Ayurveda the ultimate aim is health. Okay, so if if for health, if non-vegetarian food is required, that should be taken. Okay, so just the myth, to clear out that myth, that Ayurveda doesn't at all ban non-vegetarian food or alcohol, that for that matter, but it prescribes it whenever it is necessary and wherever it is required for health. Okay, so for a physical work that can be used, for an intellectual, like I was saying ki, scientist ho ya fir IT people ho, what we can go for is these are again medicines. Okay, so these are medicated ghee, like Kalyanaka Dhruta is there, Jatamounsi is one of the herb, Indian herb is there. So Fanta is, what we do is generally we take that Jatamounsi, we take that drug and we soak it in the water for 6 or 8 hours, then keep it like that for 6 7 hours, and then after that we crush it and then filter it out and we intake that water. So that is the Jatamounsi Fanta. So what it does is it just relaxes your mind, it relaxes your brain, it decreases your anxiety, stress, like that. So such are the things which can be applied for an intellectual person. Then the person who are in a sedentary work. So for that, for such persons, there are medicines and formulations in Ayurveda which can decrease the fats like tissues. Okay, we call it like a Meda Dhatu, we call it like a kapha dosha. So whenever we are in a sedentary lifestyle, we do not move, so kapha starts to aggravate in our body. So for whoever of a sedentary lifestyle, they can go for the medicines in Ayurveda which are definitely easily available, and they can be used to prevent the disorders in a long run. Like in a 30s also, that you are going to work in an IT, and along with intellectual, you are going to do the work in front of laptop only. So what you can apply is a little bit of an exercise and along with some medicines which can be prevent the next cardiovascular diseases and all that. Okay, so these are some of the things which can be applied. Then AC work, which is the also most common thing which has happened now in our works and also at our homes. So our for that also we have some medicines which can be used, like Dashamularishta is there. But please, again, I'm saying again and again, because it has to be told again and again. It needs to be taken under medical supervision. Okay, if there are teachers, like we most of us are academicians, so we have to give lectures in front of 100 to 100 students, and we have to speak for 2 3 hours continuously. So for such people, what we can do is we can take a milk, but that also a medicated milk, like a gestamal or liquorice. We can add that licorice in the, what you can say, milk, so usko thoda ubala jaye aur fir wo piya jaye. It gives a strength to your what you can say, to your throat and to your respiratory system. So what happens is, because of that strength, you avoid the disorders related with your respiratory disorders. Even the most simple thing which we applied during COVID was using the black resins. It is also one of the best remedy to give strength to your respiratory system. Black resins at the night, it gives definitely a good strength to your respiratory system. बल देता है, ताकत देता है आपके आवाज को, आपकी सांस को ताकत देने वाला है. तो वो अप्लाई बहुत ज्यादा होता है. तो जिनको ये पता है कि अस्थमा की तकलीफ है या फिर हेरेडिटरी कुछ इशू है, तो वो पहले से ऐसी चीजें सेवन करेंगे, खाएंगे, तो इट कैन प्रिवेंट द फर्दर डिसऑर्डर्स. Also the people who work under dust fumes, etc., so there are medicines which again prevent such external stimuli, like I have mentioned here. But just I will suggest all of you to take an prescription from the nearby physician first before going to that. I'm just giving these slides to understand how we can apply Ayurveda. ओके, एंड वर्किंग नियर हीट, जो खाना वगैरह बनाते हैं सभी को पता है, वो बड़ी बड़ी भट्टियां होती है, उनके सामने रुक कर वो रोटियां वगैरह सेकना, ये सब चीजें होती है. तो वहां पर ठंडे गुण वाले जो होते हैं ना, मिल्क हो, घी हो, चंदन हो, सारीवा हो, इन सारे जैसे मेडिसिन जो है वो डेली उनमें थोड़े थोड़े अगर सेवन किए जाए, तो उनके वजह से जो आगे जाकर डिजीज हो सकते हैं वो प्रिवेंट हो सकते हैं. नाउ द मोस्ट इंपॉर्टेंट पार्ट फॉर एनीबॉडी, क्या होता है कि आजकल जो भी कुछ वेस्टर्न से आता है वो हेल्दी समझा जाता है, वो अच्छा समझा जाता है. सो दैट इज द मेजर इशू इन आवर थिंकिंग. बट एक चीज जो है कंसेप्ट आयुर्वेद में बताई गई, दैट इज मोर ऑफ एन सात्म्य. सो व्हाट सात्म्य सेज जो जहां पर उगता है ना, वो उस व्यक्ति के लिए हैबिचुअल होता है. Okay, so that's why if you want a basic advice, if you want an advice on the diet in a single sentence, I will say that you should eat local and you should follow your culture. If you are doing this one thing now, you will not do the blunders related with it. It is very basic thing. What is happening is, in a way of trying the new things. So we are trying new things not just with the technologies and all. We are also need to try new and new dietary things and fats and trends, कि ये खाकर देखना चाहिए, फिर आगे जाकर पिज्जा खा के देखा, फिर बर्गर खा के देखा. If it is habitual to us or not, we are not checking it out. We are just want to try everything out. And what happens is, it starts with a trying out, and then after some time it becomes a habit, and that habit leads to business. So a single line, if you want to take an advice on diet, it should you should prefer the local food and you should follow the culture, because whatever the dietary patterns which are told in our culture are are just the percolations of Ayurveda, nothing else. If you can go on the internet and search for festivals and Ayurveda, you will definitely get this correlation, कि how our festivals and what the desserts or whatever the recipes we make on our festivals, these are not related with the festivities, they are more related with the health during that season. Like we are just going to have a Diwali in next few days. So in Diwali, even in in Maharashtra, we all use all the spices, not just spices. We eat too much of sweet, we eat too much of oil. Okay, so if you show such type of our Diwali desserts to some dietitian, he will say this is the most unhealthy food out there. Okay, but I can say you with much confidence that for the season during which Diwali comes, that is more of an winter season, that food is the only healthy for that person during that season. Okay, so please keep in mind that whatever the culturally derived foods or recipes are there, they are not just for your tongue, they are for your health. So that is the basic rule which anyone can follow. Okay, still what we can do is basic rule होता है कहीं का भी, कि जितना सप्लाई होता है उतना ही डिमांड होता है. सो प्लीज हमें ये हमेशा याद रखना है कि जितना हमारा शरीर मांग रहा है उतना ही देना चाहिए. दैट इज द फर्स्ट बेसिक थिंग. देन दूसरा ये होता है कि ऐसे भी नहीं करना है कि शरीर ज्यादा मांग रहा है और हम कम दें. ओके, सो दैट हैज टू ऑल्सो बी कीप इन माइंड. Third is the most important aspect is the keeping it regular. This is the most important thing related with diet. Irregularities leads to more gastrointestinal disorders rather than the content of a food. Okay, so time of a diet is equally important to the content. Okay. Then, fourthly, as I said, don't complicate your diets. Please don't try to do ये कार्बोहाइड्रेट का 30% लूंगा, ये प्रोटीन वाला 30 लूंगा, फिर ये 30 फैट लूंगा. See, हमारी body, it's not a mathematics, it's not just a machine, it's a biology. Okay, and when it is a biology, now it is never 1 plus 1 is equal to 1 plus 1 is equal to 2 happens in mathematics, but it doesn't happen in biology. 1 plus 1 जब बॉडी में चला जाता है ना, ये 2 होता है, आधा होता है, 11 होता है, 13 होता है, कुछ भी होता है. So what basic thing which can follow is, don't complicate your diets. Don't use complex diet patterns. Keep it simple and keep it whole. ठीक है. एंड देन तीन मेजर ब्लंडर्स जो डाइट से रिलेटेड आयुर्वेद ने बोले हैं, वो जो अभी मैंने एक बोला था, कॉम्प्लेक्स डाइट पैटर्न. कॉम्प्लेक्स डाइट पैटर्न में जनरली जो हमारे यहाँ KFC में वगैरह आप जाते हो, तो वो होता है ना कि 800 या फिर 1000 रुपए देते हो, एंड फिर आपको फिर वहां पर बैठना होता है. फिर आप जो मांगोगे वो लाया जाता है. फिर आइसक्रीम भी उसी में होता है, नॉन वेजिटेरियन भी होता है, स्वीट डेजर्ट भी होता है, दूध का भी कोई पदार्थ होता है, वो भी आप खाते हो. दैट ऑल बिकम्स कॉम्प्लेक्स डाइट. ओके, सो व्हाट हैपेंस इज, जब इतना सारा आप स्टमक में डालते हो तो स्टमक को पता ही नहीं चलता कि पचाना किसको और किसको नहीं. ओके, सो दैट इज द मेजर ब्लंडर. सेकेंडली, फ्रीक्वेंट ईटिंग, ये आजकल थोड़ा ट्रेंड हो चुका है, बट इट इज टोटली नो अकॉर्डिंग टू आयुर्वेद. अकॉर्डिंग टू आयुर्वेद हमें सिर्फ 2 बार खाना खाना होता है, नॉट इवन ब्रेकफास्ट. Just to clear again one myth, breakfast was never a part of Indian culture. Breakfast come to India through English people, because their environment is a cold one, so they need a breakfast. Okay, so for an Indian subcontinent, we don't need breakfast per se. What we need is 2 times of meals. Let it be 10 and 11, 10 to 11, and evening at 7 to 8. Those 2 meals are only expected. You are not expected to eat in between. Okay, so frequent eating is not at all healthy. That is the second blunder which you can do. And lastly, जैसे मैंने बोला था, earn time limits. What need to be done is time limits. आप कुछ भी काम कर रहे हो, काम छोड़कर 1 बजे अगर आपको भूख लग रही हो, तो 1 बजे खाना खाना जरूरी है. So that is an important part. Again, these are some examples के कैसे कैसे यूज होते हैं. I will not go into the details. I think I will share my PPT with organizers. You can take them from organizers. But it's just example. Okay, शीत means cold होता है. So cold. This is explained by Acharya Sushruta. You must have heard from Chinmay sir. So there are, according to the qualities of food which we can use in the diseases. Like, we have hyperthyroid disorder or we have bleeding disorder. You can go for a food or medicines which are of a cold property. Like on the contrary, if you have asthma, you have hypothyroidism, you can go for more of a hot properties. Okay, same with snigdha. Again, that snigdha gun ka matlab more of a, you should have some fats, oils in your food. Okay, so that is one aspect which is very much important in joint disorders, spine disorders, osteoporosis, in even in Alzheimer's. So one more myth I would also want to clear out is, uh, through last, I think, 4 5 decades, what was bombarded on our minds that eating the ghee, eating the oil is the sin for your body. आई मीन आपको घी और तेल ऐसी चीजें खानी ही नहीं चाहिए. ऐसा 30 40 साल में हमें बहुत ज्यादा बम्बार्डिंग किया गया. एंड इस वजह से लोगों ने, फिर वो हार्ट अटैक आता है वगैरह, ये सब चीजें होती है, इसलिए वो खाना बंद कर दिया. एंड उसके वजह से फिर अगेन बहुत सारे डिजीज हुए वो बाद में. लेकिन जस्ट रिसेंटली अगेन यू कैन डू इट, यू कैन सर्च इट ऑन गूगल, that few years back only, the modern medicine research has also been carried out. They showed that cholesterol itself is not a risk factor for cardiovascular disease, or it is not a blaming factor for the cardiovascular disease. So for last 40 years, they were saying that cholesterol is bad for your heart. And now at this stage, after doing research, now they are saying that cholesterol is not bad for you. So, that's why I'm saying is ki follow your culture. What happens is, ये half cooked researches keep on happening, and they keep on saying that कि ये अभी अच्छा होता है, फिर थोड़े दिन के बाद बोलते हैं कि ये अच्छा नहीं होता. Okay, so better go for more of a common sense knowledge which has been there in your cultures, that helps you more than the half cooked knowledge. So that why I'm saying that when it comes to snigdha, when it comes to fats and oils, it is a very important part of our food. It has to be there. Okay, so that is the snigdha gun. Then there is a dry type of food which can use, for diabetes, obesity, like such disorders. Drava means more of a liquid food. So in a cancer, CRF, ascites, in cancer, for more of, what happens in cancer is there is too much of an decreased digestive power. So for that, more of a liquid rather than a solid food. Shushka is more extreme dry. The important is ekakala and dvikala. What is meant by ekakala is a eating only for a single time, single meal a day, and dvikala is a person who can take 2 times a meal. So ekakala single time ही meal को किसको लेना चाहिए? इन rheumatism हो, obesity हो, autoimmune disorder हो, जिसकी digestion खराब हो चुकी है, इन सबको दिन में एक ही बार खाना चाहिए. एंड द्विकाल किसको लेना चाहिए? फॉर एन हेल्दी इंडिविजुअल. दैट्स व्हाई आई सेड कि इन इंडिया एंड फॉर एन इंडियन सब कंटिनेंट, ईटिंग 2 times of meals is a healthy one, not more than that. ओके, देन मिक्स विथ मेडिसिन है. मात्राहीन का मतलब होता है क्वांटिटी वाइज कम खाना. So in irritable bowel syndrome, you must have heard of IBS, irritable bowel syndrome, liver disorders. इसमें आपको जितनी भूख होती है उससे थोड़ा कम खाना चाहिए. ऐसे होता है. फिर दोष प्रशमन यानी थोड़ा सा जो हमारे वात पित्त कफ जो होते हैं उनमें उन पर काम करने वाला जो फूड होता है वो. और वृत्त्यर्थ का मतलब होता है फॉर द कंटिन्यूएशन ऑफ अ हेल्थ. सो दीज आर सम ऑफ द टाइप्स ऑफ फूड विच आयुर्वेदा सजेस्ट. आई हैव आल्सो गिवन इट. अगेन मैं ये करता हूँ कि मैं पीपीटी आपको दे देता हूँ, तो वो एक उसमें आपको ज्यादा बेटर रहेगा, बिकॉज ये सब एक्सप्लेन करना इतना इजी नहीं है विद इन शॉर्ट टाइम ऑफ पीरियड. आई डोंट नो हाउ मच. I think 10 15 minutes at least I have. So there are, according to Ayurveda, there are 6 tests. So according to test also you can use in specific disorders like cancer ho, AIDS ho, multiple sclerosis ho, Alzheimer's ho. So in such disease your food should be more of a sweeter test. Okay, and if you are in a depression stage, if there is a chronic fatigue syndrome, it is better you go for a sour. Okay, and similarly indigestion hai, acid reflux बहुत ज्यादा है, gallstones है. So some of a salt should be there in your food. Then bitter test is one of the most common tests which is used by Ayurveda. In allergic reactions, worms, edema है, benign tumors है, इन सब में ये bitter test यूज किया जा सकता है. पंजेंट यानी तीखा जो होता है वो स्किन डिजीज में, अल्सरेटिव कोलाइटिस में थोड़ा बहुत हम यूज करते हैं, फीवर में है, डायरिया में है. या फिर एस्ट्रिंजेंट टेस्ट जो होता है वो लाइक इन डायरिया कभी कभी हम यूज करते हैं. अगेन इट डिपेंड्स अपॉन द कंडीशन ऑफ अ पेशेंट. कोलाइटिस है, कार्डियोमेगाली है, इन सब कंडीशन में ये टेस्ट वाले मेडिसिन या फिर फूड जो है वो यूज हो सकते हैं. देन सम ऑफ द एस्पेक्ट्स जो नींद के साथ जरूरी होते हैं. अगेन सब में चीजें पढ़ के नहीं बताऊंगा, लेकिन वॉट एवर इंपॉर्टेंट इज, हमें ये सबसे बेसिक ध्यान में रखना है कि वी आर नॉट द नाइट क्रीचर्स. ओके, मैंने जैसे कहा हम बैटमैन नहीं है, हम शहनशाह नहीं है. हमें रात में काम करना जरूरी नहीं है. हमें रात में सिर्फ सोने का काम करना होता है. काम करने के लिए हमारे भगवान ने हमें दिन दिन जो होता है वो दिया है. सो हमें माइंड में रखी, नाइट विजिल इज नॉट एट ऑल अ पार्ट ऑफ ह्यूमन लाइफ. Okay, we should not remodel our bodies for a night work, for nocturnal work. Okay, please keep that in mind, that is very important. Also जैसे हमने रात में सोने के लिए बोला, वैसे हमें ये भी याद रखना है कि दिन में सोना जो होता है इट इज वेरी अनहेल्दी. सो दैट हैज ऑल्सो शुड बी केप्ट इन माइंड. देन अगर समझो आपको डाइजेशन हो गया, बहुत रात तक आप 12 1 2 बजे तक आपको काम था, इसलिए तो व्हाट वी कैन डू इज एटलीस्ट जब आप खाना खा रहे हो तो वो दूसरे दिन खाना खाने से पहले थोड़ा सोना, ये हेल्दी बोला गया है. हल्का खाना ऑफकोर्स होना चाहिए. हमें सभी को पता है कि रात का खाना जो इट शुड बी अ लाइट, इट शुड नेवर बी हेवी. ओके, देन सभी को पता है हमारे यहाँ पादाभ्यंग किया जाता है, यानी हमारे जो फुट सोल्स होते हैं ना, उसको ऑयल लगाने से इट इज वेरी रिलैक्सिंग टू योर आईज एंड इट इज वेरी रिलैक्सिंग टू योर ब्रेन. सो दैट इंड्यूसेस अ ग्रेट अ बेटर साउंड स्लीप. So that is one of the remedy for sleeplessness. Also, one interesting thing you can do if you are going through insomnia, and only if your digestion is good, you what people can do is some 30-50 ml milk mixed with 1 teaspoon of go. Okay, then that should be an original, not of Patanjali and all such companies, but that should be a homemade ghee. That definitely helps in better sleep. Okay, then बॉडी मसाज हेल्प करता है. कुछ एरोमेटिक हर्ब्स होते हैं, उनका स्मेल जो होता है उससे भी नींद जो होती है वो अच्छी लगती है. तो ये सभी चीजें नींद अच्छी लाने के लिए जरूरी होता है. और उसके साथ साथ शिरोधारा करके होता है, आपने वो सुना होगा. अगर आप आयुर्वेद भी गूगल पर डालोगे तो सबसे पहले फोटो जो आता है वो कोई ना एक लेडीज या फिर जेंट्स सोया हुआ होता है और उसके वो चेहरे पर वो ड्रॉप डाल डाल रहे होते हैं. So that is the most famous image for Ayurveda. That is called as a Shirodhara. That is one of the treatments which can be used for insomnia and all that. Even Shirobhyanga यानी हेड मसाज जो होता है, ये सब हेल्प करते हैं नींद के लिए. देन बहुत इंपॉर्टेंट एस्पेक्ट आता है ऑफ एन ब्रह्मचर्य. दैट इज सेल्फ डिसिप्लिन. अगेन टू क्लियर इट आउट मोर, ब्रह्मचर्य डजंट एट ऑल related with only sexual activity. Okay, a brahmacharya is a very broad concept. What is expected is you should have control on all your bodily senses and not just sexual activity. Okay, so that is expected by brahmacharya and not just going away from sexual activity. So that's why I have used the example of allegory of a chariot. We all know this example given by Bhagwan Shri Krishna in Bhagavad Gita, which actually first come from the Kathopanishad. So that is the chariot's example with Bhagwan Shri Krishna gives that our mind is like the reins of the chariot. So our mind should be strong enough to control our senses. And for that mind to be strong, our buddhi, our intellect need to be pure. And when our intellect is pure, our mind works better and it can have control over your senses and you can achieve the self-restraint, aka brahmacharya. So brahmacharya is very much important in preventing the disorders. कैसे होता है ये आगे भी देखेंगे. एंड देन देयर इज आल्सो कांसेप्ट ऑफ व्हाट वी कॉल सद्रुत. इट इज मोर ऑफ एन एथिकल बिहेवियर. जैसे मैंने कहा कि जब आप सोसाइटी में रहते हो, व्हेन यू आर इन द योर फैमिली, सम बेसिक रूल्स जिसे बोला गया है कि वो सद्रुत होता है. और ये सद्रुत इज नॉट जस्ट फॉर पर्सनल हेल्थ, इट इज आल्सो इंपॉर्टेंट फॉर योर साइकोलॉजिकल हेल्थ एंड आल्सो फॉर द सोसाइटी. लाइक वी ऑल नो, इफ अभी अभी हमने सभी ने सुना होगा कि कोलकाता में वगैरह जो चीजें हुई, रेप होना या फिर उसके बाद सीवियर क्राइम होना, दिस ऑल आर डिसीजेस ओनली. Just they are not diseases at an individual level, they are diseases of a society. And for that Ayurveda gives you sadhrutta, and that sadhrutta will help in decriminalizing the society. That is another aspect of application of Ayurveda for whole society. So these are few things which can be used for a better psychological health, to not overburden your brain and not to overburden your senses. Okay, so do not pander to fickle mind, and you should not chase your mind. Your mind should be in your own control and not getting imbibed in the chain of thoughts. Like mind, जहां पर आपको वो mind आपको लेके जा रहा है वहां पर आपको जाना, that is not what is expected. Okay, don't be too impatient and too much excited. यानी जो अगेन भगवत गीता में जो बोला है वही है कि व्यक्ति को स्थित प्रज्ञ होना चाहिए। यानी बहुत ज्यादा चीजें देखकर एक्साइटेड भी हो जाना और एकदम से डिप्रेशन में चला जाना, ये दोनों चीजें जो होते हैं दे शुड बी अवॉइडेड। एंड ऑल्सो लास्ट थिंग विच इज इम्पोर्टेंट, विच इज प्रीच्ड बाय आयुर्वेदा highly, is the mindfulness. When I say mindfulness is, you should be aware of your own health. You should be aware of what is good for you and what is not good for you. You should be aware of your environment, about your constitution, about your family, and about your society. That mindfulness very much important to prevent the psychological. So that mindfulness is one of the part of Ayurveda. And this is the very interesting concept which is mentioned in Ayurveda, is a prajnapara. You can call it an volitional transgression. यानी इसका मतलब ये होता है कि मुझे पता है कि मेरे लिए गलत क्या है, एंड स्टिल आई डू दैट। यानी मुझे पता है कि जब मैं केला खाता हूँ तो मुझे सर्दी खांसी होती है और कफ होता है, स्टिल मुझे लगता है कि ना एक खाऊंगा तो कुछ नहीं होगा। तो मुझे पता होता है कि ये जब अगर मैं करूंगा, इट इज गोइंग टू हार्म मी फॉर फ्रॉम हेल्थ, फॉर फाइनेंस और एनीथिंग, एंड स्टिल आई डू दैट। दैट इज कॉल्ड एज अ, so doing the wrong things knowingly is what is Ayurveda called as a pratyahara. And this is the, you can say, root cause of everything. Any disaster is caused from pratyahara. Okay, यानी हमें पता होता है कि हम गलत कर रहे हैं फिर भी हम करते हैं। Okay, क्योंकि हमारा सेल्फ रिस्ट्रेन नहीं होता। So that's why prajnapara is called as a root cause of every suffering, and it happens because of dysfunctioning of buddhi, dysfunctioning of धारण शक्ति। Okay, हमारा सेल्फ रिस्ट्रेनिंग का जो पावर होता है वो नहीं होता है, हमारी मेमोरी जो होती है, लास्ट मिस्टेक जो होते हैं वो हम भूल जाते हैं, इसलिए ये सब चीजें होती है। नाउ दिस हैज ऑल गॉन टू द व्हाट यू कैन से during the lecture only session only, I said about that we have to work at different levels. So here are other things at which we have to work for Ayurveda to take it to the next level. So at an institute level, what we can do is at a PHC, CSC. PHC is a primary healthcare center which is present, at the rural hospitals like that. Then at national health programs जो हमारे होते हैं, आयुष की स्कीम्स जो होती हैं, एनजीओ होते हैं, इन सभी लेवल्स पर हमें काम करने चाहिए। सी बहुत सिंपल सिंपल चीजें हैं कि पीएचसी में क्या होता है कि बहुत रूरल एरियाज के जो अफोर्डिंग पेशेंट्स नहीं होते जिनको, वो पीएचसी में वगैरह जाते हैं, तो सिंपल आयुर्वेदा मेडिसिन जो होते हैं विच वी कैन यूज एट पीएचसी लेवल, ताकि हम वो यूनिवर्सल हेल्थ केयर प्रोविजन जो है वो एट द एंड यूजर तक हम पहुंचा सकते हैं। वो एक चीजें हो सकती है। सेकंड विच वी कैन डू एट दिस इज यूजिंग अ फोकलोर मेडिसिन। ये हम फोकलोर मेडिसिन ऑल्सो इज नॉट, हमें ये याद रखना है कि ये अंधश्रद्धा नहीं है। It is folklore medicine is a medicine. If used by a good Vaidya, it can definitely be implemented in national level. That is using the folklore medicine effectively. Then also we can induce some policies and strategies according to the need of that area. See, India is a very vast country with very vast cultures. So every area has a different problems. So we can generate more policies and strategies according to that area. Okay, like in hilly areas the disease burden will be different, at the sea level the disease burden will be different. So accordingly we can define the and decide the policies and strategies. And what we can do is we can train the medical officers to use some ayurvedic dietetics part in the pathya advice they give to the patients. These are very basic things which ayurveda can do, which can do the betterment for the promotion of it. एंड दीज आर सम ऑफ द माय आइडियाज व्हाट वी कैन डू इज, सभी को पता है कि जैसे पोलियो इरेडिकेशन प्रोग्राम होता है, मलेरिया इरेडिकेशन प्रोग्राम होता है, ट्यूबरकुलोसिस होता है, तो उसमें ये सब चीजें हम कर सकते हैं। एंड इट इज नॉट दैट हार्ड। व्हाट वी नीड इज अ डिसीजन कि ओके चलो आज से हमें ये करना है। ओनली दैट थिंग हैज टू बी देयर। तो ट्यूबरकुलोसिस में हम ये सब चीजें कर सकते हैं, कुछ मैंने लिखी है आयुर्वेद की। फिर मैटरनल और चाइल्ड केयर में गर्भिणी परिचर्या, गर्भ संस्कार आपने सुना होगा, ये हम इंप्लीमेंट कर सकते हैं एट अ नेशनल लेवल। एंड ऑल्सो NPCDCS इज मोर ऑफ एन, जिसे हम बोल सकते हैं कि कार्डियोवैस्कुलर डिजीज, कैंसर, इसके लिए आयुर्वेद जो है वो काम कर सकता है। इसका सिर्फ मैंने एक एग्जांपल दिया है कि CCRH जो हमारी एक रिसर्च की आयुर्वेदा की बॉडी है सेंट्रली, उन्होंने ये एक प्रोजेक्ट किया है। गढ़चिरौली जो महाराष्ट्र का भाग है, वो बहुत ही रूरल एरिया है, वहां पर उन्होंने क्या किया कि 10,000 वीमेन जो होते थे, यानी प्रेग्नेंट वीमेन थी, उनको उन्होंने वो गर्भ संस्कार के तौर पर बहुत सारे आयुर्वेद की जो लाइफस्टाइल जो थी वो उनको सिखाई, आयुर्वेद की तरीके के मेडिसिन उनको दिए, और उनका बहुत अच्छा रिजल्ट आया है। सो सच थिंग्स आर हैपनिंग, बट दे नीड टू बी डन एट अ मास लेवल. Okay, so this is just one project. It has to be implemented at every stage in every state, so that can be done for more propagation of Ayurveda. These are some of the you might not have known about that, but if I will suggest all of you who are interested in whether to please go to the website of our Ayush. There are various schemes propagating now. Okay, so Ayur Swasthya hai, information, education, communications, all these schemes are given by our government nowadays. It is available to you. What you need to do is you need to apply for them. ओके, बट इस सब में ना ध्यान रखने वाली सिर्फ बात यही है कि पॉलिसीज अच्छी तभी होती है जब उनका इम्प्लीमेंटेशन अच्छा होता है। सो ये सब होती हैं, लेकिन जब तक इनका इम्प्लीमेंटेशन एट अ गुड लेवल नहीं होता, इट डजंट वर्क फॉर इट. Okay, and this is also one of the Ayush schemes propagated by our ministry, is a national Ayush mission. So these are all the schemes which can be used and which can be implemented at a national level to propagate Ayurveda first at national and then at international level. So these are also some of the parts. Then of course one of the major part which need to be targeted is a research. So we all know that in this 21st and 22nd century is about evidence based. So everything you are talking has to be evidence based. You cannot speak in air कि इससे ये होगा, ऐसे बोलकर ये नहीं चलेगा. You have to show, you have to create the evidence for your own statements. So that definitely has to be there. So research होना जरूरी है, लेकिन क्या होना चाहिए इसके लिए कुछ एग्जांपल्स दिए कि हेल्थ असेसमेंट ऑफ इंडियन इंडिविजुअल बेस्ड ऑन आयुर्वेद पैरामीटर्स. हाल ही में अगर आपने सुना हुआ कि हमारे जो अभी ऑनरेबल आयुष मिनिस्टर है प्रताप राव जाधव जी, तो उन्होंने अभी एक अभियान स्टार्ट किया है, देश का प्रकृति परीक्षण. सो इट इज अभियान जो है अभी स्टार्ट हुआ है कि अभी हम जो बोल रहे थे ना कि हर एक व्यक्ति की प्रकृति, तो वो आयुर्वेद के हिसाब से हर एक व्यक्ति की प्रकृति एसेस करना, ये अभियान हमारे अभी मिनिस्टर जो है ऑनरेबल उन्होंने स्टार्ट किया है. दैट इज द टिपिकल वर्क विच वी नीड एट दिस स्टेज. सो दैट इज द हेल्थ असेसमेंट. देन फाइंडिंग द हेल्थ डिटर्मिनेंट्स. अभी जो हमने बोला है कि कौन से फैक्टर्स हेल्थ को डिटरमाइन करते हैं अकॉर्डिंग टू आयुर्वेदा. ओके, सो वो जो फैक्टर्स है उन पर रिसर्च होना चाहिए. सिर्फ ये एक चीज खाऊंगा तो ये अच्छा होगा ऐसे नहीं है. सिर्फ आई ऑलवेज गिव दिस एग्जांपल. हमने सबने ये वी हैव लर्न दिस इन बायोलॉजी बुक दैट इफ यू हैव नाइट ब्लाइंडनेस, इफ यू हैव विटामिन ए डेफिशिएंसी, देन यू हैव टू ईट द कैरेट. राइट, तो आप वो कैरेट खाते हो तो वो आपकी आईज की ताकत बढ़ती है एंड देन वो ब्लाइंडनेस वगैरह कम होता है. आई ऑलवेज क्वेश्चन सच स्टेटमेंट्स. Does the carrot decides कि खाने के बाद I will only go towards the eyes and I will not go towards the intestine, I will not go towards the kidneys or liver. ऐसे नहीं होता. Whatever you eat, it affects the whole body. इसीलिए यू कैनॉट से कि कैरेट खाओगे तो आंखें अच्छी होगी. ओके, इन अ मेडिकल साइंस देर इज नेवर 1:1 रिलेशन. इसीलिए जैसे बोला जाता है लहसुन खाओ तो कोलेस्ट्रॉल कम होगा, ये खाओ तो कैंसर कम होगा, ऐसे कभी भी नहीं होता. तो जब आप कोई भी चीज खाते हो इट अफेक्ट्स ऑल द पार्ट्स एट इक्वल प्रोपोर्शन. सो फॉर दैट पर्पस जब आप कौन सी चीज हेल्दी है और कौन सी चीज अनहेल्दी होती है, यू हैव टू डिसाइड आफ्टर इट्स इफेक्ट ऑन होल बॉडी, नॉट जस्ट एंड वन ऑर्गन. ठीक है, यानी एक चीज आपके हार्ट के लिए अच्छी होगी तो वो दूसरे जगह पर वो लीवर को अगर अच्छी नहीं है, इट शुड नॉट बी कंसिडर्ड. So that type of research is to be needed. Then human environment relation, because आयुर्वेद के जो बहुत सारे मेडिसिन हैं, डाइट के प्रिंसिपल्स हैं, दे आर मेड मोर फॉर एन इंडियन सबकॉन्टिनेंट. So if you go for the Western countries, the environment is totally different. So you have to understand the human environment relation in that context. And after understanding their human environment relation, you need to change some things, not the basic principles. Lekin application of that principle has to be changed when you go from Indian subcontinent to the Western countries. So that type of research also need to be done. Then to disprove some myths, like I was saying some of the few that high water intake is healthy, or regular use of leafy vegetables is healthy. So such these are definitely not at all healthy. These are myths. So there has to be some researches which will break such myths. Then new drugs are coming, new herbs are coming. So we have to decide their pharmacological action from Ayurvedic perspective. Such type of research can be done. And then long term researches, like nowadays you must have heard that cancer, one of the major cause for the cancer is said to be the hybrid type of food, inorganic food. What happens is, doing such statement in front of people is very easy, but proving it and doing a evidence based research is a different thing. So for that purpose, such long term researches has to be done. Like the people who are, if you say or not, they are going to eat that type of hybrid food, then you have to do some 30-40 years long research on these people, and then you can say ki, okay, because of such things it leads to more cancer. Okay, so such type of Ayurved oriented research has to be there. Then internationally, of course, work has to be done, like knowledge exchange program होना चाहिए. अभी already हो रहा है कि आपको अगर पता है या नहीं पता नहीं. There are Ayush chairs which are now appointed in the foreign countries like Hungary and all. तो वहां पर क्या होता है कि हमारे यहाँ के जो renowned physicians होते हैं, they visit the and stay in the foreign countries for 1 year or 2 year from as a representative of Ayush ministry, and they do the propagation of Ayurveda there. So such type of programs need to be done. Also, the awareness about the strengths and solutions of Ayurveda can provide for that. That is very important. Okay, we need to break the bias of allopathic people. So that is one thing. And then major area of work is research. So we need to do some international level research. And I'm not saying international level, not in a sense of a standard. I'm more of an international collaborative research, which can open up many areas for Ayurveda. Because see, ultimately, what is happening is, there are take ahead any science. First is money, and second is research. Only two things there are there which can help in science. See, मैं कितना भी प्रैक्टिस करूं, आज मैं पुणे में हूँ, ऑलमोस्ट जो कुछ मुझे अभी सुन रहे हैं उनको पता नहीं है कि नीलेश पाटिल कौन है. Okay, on the contrary, अगर if I do some research which increases the Ayurveda strength, and it gets published somewhere, you will know कि अरे कोई पुणे से नीलेश पाटिल है जिसने ये रिसर्च किया, एंड उसने प्रूव किया कि आयुर्वेद का ये प्रिंसिपल अच्छा है. What happens is, because of research you reach more people. Okay, so that's why research is important. Second is, of course, without a doubt, it's a finance. So these both things go hand in hand. So ये दो चीजें जरूरी है. ये सब चीजें करने में फिर इश्यू क्या है ये भी पता होना चाहिए, कि ये सब अच्छी अच्छी चीजें बोल दी, लेकिन वहां पर चैलेंजेस भी बहुत हैं, बैरियर्स भी बहुत हैं. सो देयर इज फर्स्ट थिंग इज अ कम्युनल. As I said, we still, when it comes Ayurveda, we always, connected with India, we always connected with religion, and that should not happen. We should think about Ayurveda as a medical science purely. That is very much needed. See, if you want to take Ayurveda to global level, you should break some chains. You have to break away from certain things, and you have to propagate it as a pure medical science. That is the basic thing. Second is economical. It has been an issue for Ayurveda in past governments, but in this government, it has definitely increased, financial budgeting for Ayurveda. So it is increasing, but it is still very meager compared to modern medicine. But it is increasing. So that is also an issue. As I was saying, money is very important. Then there is an evidence, like same we were talking about, that you have to show some evidence. You cannot say कि नीलेश पाटिल ने बोला इसलिए आपको accept करना पड़ेगा. You have to show the evidence whatever the statements you are making. And lastly, human resources, because Indian knowledge system के सभी systems को including Ayurveda, there is very much lack of human resources. बहुत कम लोग हैं जो आयुर्वेद की प्रैक्टिस करते हैं, जो आयुर्वेद को मानते हैं. तो ये भी चीज बढ़ना जरूरी है. तो ये सब अभी चैलेंजेस हैं लुकिंग गोइंग अ वे फॉरवर्ड. तो ये चार चीजों को हमें ध्यान में रखना चाहिए अगर हमें आयुर्वेद को आगे लेके जाना है. सो overall, through all this lecture, what I was trying to take from individual level to institute level, आयुर्वेद को आगे लेके जाने के लिए क्या क्या हम कर सकते हैं, कैसे कर सकते हैं, उसके लिए बैरियर्स क्या हो सकते हैं. सो सिर्फ कोई एक डिसीज पकड़ के उसमें आयुर्वेद क्या करता है, इससे भी ज्यादा मुझे लगता है कि इट शुड बी मोर ऑफ एन आवर एम टू अंडरस्टैंड आयुर्वेदा एज अ होल एंड देन टेक इट फॉरवर्ड विद अ ग्रेटर विजन एंड नॉट जस्ट कीपिंग इट लाइक कि यार कोविड के लिए आयुर्वेद क्या करेगा या फिर कैंसर के लिए आयुर्वेद क्या करेगा, बिकॉज ये सिर्फ 1:1 होगा, हमें मल्टीपल डायमेंशंस पर मल्टीपल लेवल पर काम करेगा। तो एक एज अ विजन देने का मेरा ये आज का प्रयास था। सो आई जस्ट होप कि मुझे जितना कवर कर पाया मैं उतना मैंने कवर किया है। आई थिंक दैट्स द लास्ट, यस। So I think that's all from me. If anybody has any questions or if they want to express their other opinions also, if they can please. Thank you.
Thank you, Nilesh. Thank you. I think we have extended a bit, but it's okay. We can have one or two questions. I can request the audience to. If you can stop sharing your screen, sir, I think that would be better.
Yes, please, please. If anyone have questions.
Yeah, yeah.
Yeah, sure.
So, any questions on the audiences?
Step.
A very comprehensive session, sir, I think, because policy is something that I also work on. And as a subject, all people should be aware of policy, practitioners or people who are on the other end, patients. And
Correct.
because we always think it's the state's responsibility or government's
Yeah,
responsibility, it is not. It also is our responsibility too. And if you want to promote our knowledge systems, it is very, very crucial that we understand them in a global
correct.
context. Yeah, yeah. So thank you for that very, very different view. Rather, we were hoping more. We have since morning it has been more about theory and but this was
Yeah.
more of policy orientation. So thank you for that. Uh, any questions? We can have one or two. So मैं रिक्वेस्ट करता हूँ कोई अगर सवाल होंगे तो बेझिझक पूछिए. As you have observed, all the speakers have been very kind and open with all the comments and questions. You can go ahead and ask. Okay, so I can take silence as a thing that there are no questions. So with this, we conclude for today. Acha, oh, there is one from Abhishek ji. Uh,
Okay.
contact details. I think we'll
Okay.
share the presentation. The presentation has the contact details, right?
Okay. Okay. Sure. Yeah, I will
You,
be sharing the PPT with the
yeah, yeah,
organizers.
yeah.
You will get
So
it.
I think Abhishek ji, you will get the PPT. The team is compiling a folder rather with all the presentations of all the speakers. So we'll share that shortly. Any more comments or questions? No. Okay. So thank you. Again, I thank you, Dr. Chinmay, Dr. Yevlikar, and Dr. Nilesh Patil for their very, very informative and articulate sessions. And with this, we conclude for today's day. Thank you, sir. Thank you again.
Thank
Thank you
you.
for
Thank
your time.
you.
Yeah.
Yes.